Welcome. We are considering item 4.8 of our agenda, appointment of the Regional Director for the Eastern Mediterranean. The relevant document is EB 143/11. I should like to invite our rapporteur, Dr. Mohammed, to read for the record the resolution adopted by the board during the open meeting. You have the floor, sir. Now that you have sat, I have to invite you to stand up and take the oath with the DG.
So you can raise your hand, yeah? Which one? You can this, like that.
I solemnly swear to exercise in all loyalty, discretion, and conscientiousness the functions entrusted to me as an international civil servant of the World Health Organization, to discharge those functions and regulate my conduct with interests of the World Health Organization, only in view and not to seek or accept instructions in regard to the performance of my duties from any government or other authority external to the organization.
Thank you.
Thank you.
You can sign here.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum and good afternoon. Director General, Chair, and members of the Executive Board, colleagues. It is a great honor and privilege to speak to you today. I extend sincere thanks and appreciation to the members of the Executive Board for supporting my nomination by the Regional Committee for the Eastern Mediterranean to the post of the Regional Director for the Eastern Mediterranean, and for giving me this significant opportunity to implement my agenda for change toward a stronger, healthier, and more cooperative region. I would like to start my statement by extending my deep condolences to the WHO Secretariat and to the family of Dr. Mahmoud Fikri, the late former Regional Director for the Eastern Mediterranean, who died in office last year. His death was a severe loss to WHO as a whole and to the regional office and his family in particular. I very much hope I will be able to follow his footsteps, draw on his wisdom, and build on the initiative he started in the region. Your Excellencies, you know better than I do the major challenges at all levels facing our region these days. It is passing through a critical era marked by natural and man-made crises and by severe socio-political and economic instability. Ongoing conflict has led to unprecedented increase in the number of refugees and displaced people affecting many countries, which in turn has led in many cases to increased suffering, worsening humanitarian conditions, destruction of infrastructure, and a deterioration in economic and living conditions. In my statement to the Regional Committee last week, I highlighted some of these challenges, along with some existing opportunities and threats. Based on that analysis, I presented to the Regional Committee my vision for the future of the region and the change required. In that vision, I identified 4 main categories of intervention to produce the required change. In Category 1, I emphasized some important driving forces. In Category 2, I selected the top technical priorities to focus during my term. In Category 3, I listed key leadership functions that will receive my special attention, and in Category 4, I identified some important managerial functions to enhance the managerial process in WHO the moment I assume office. Now that my appointment has been confirmed, I must work even harder to introduce the change that I advocated. I need to convert my words into action. I believe that the region needs actions for now. It cannot tolerate the status quo any longer. Every effort must be made. All available resources must be mobilized to find opportunities, appropriate solutions to these challenges. I promise you all that I will lead those efforts and put WHO on the front line to provide the necessary technical, managerial, and leadership support to all members states of the region. I will begin working with countries immediately because I believe WHO should be very close to its member states, facilitating that presence is one of my top priorities. No tangible change can be made if we are far away from the areas where change is needed. Fortunately, WHO has the technical know-how. It has become better equipped than before to respond to countries' needs, so we know exactly what we are supposed to do. We have the tools we need. Our task has become clear. There should be no further excuses. At leadership and managerial level, the appropriate planning and program budgeting functions in WHO are high on my agenda because they allow in-depth interaction with member states and enhance their involvement and engagement. As for technical work, my 4 top priority technical areas present my main agenda during my term. They include tackling health emergencies, including disease outbreaks, improving control of communicable and non-communicable diseases and their risk factors, strengthening health systems to achieve universal health coverage through primary health care approach, with special emphasis on family medicine practice connected strongly to the global call to ensure patient and staff safety during service provision, and improving maternal and child health to reduce mortality rates and address inequities efficiently. In each of these priority technical areas, current challenges contribute to increased morbidity and mortality in the region. If they are tackled properly, there will be a major impact on health status of our population. For these purposes, the regional office and country offices must be more responsive to the needs of the member states through better utilization of available resources and recruitment of qualified expertise, ensuring an appealing and transparent work environment and a competent, effective workforce. I commit to expanding the delegation of authority in the region with clear accountability and transparency inside the organization and in our relations with our other member states. Encouraging productivity, teamwork, and effective communication and better coordination, improving efficiency, and strengthening country-based capacities are just few examples of my vision in this regard. Competition, creativity, innovation, and excellence are key elements of my approach. Furthermore, no effort will be spared to strengthen coordination and collaboration mechanisms with our other partners, our United Nations sister agencies, developmental partners, and non-governmental organizations. High consideration will be given to the driving forces I referred to in Category 1 of my intervention, such as the Sustainable Developmental Goals, the 2030 Agenda for Sustainable Development, universal health coverage, the international health regulations, and the 13th General Program of Work of WHO. And as an overall rule, I will maintain a continuous dialogue with national health authorities to work together to solve national and regional health problems and to regulate, review, and update health policies and strategies. I will not hesitate to share my developments in this regard with colleagues at headquarters and in other regions. If there is any need for change in the structure, rules, and functions and operations of WHO. Your Excellencies, as a regional director, I will have the highest respect for my guidance you offer. I commit myself to stronger cooperation with all members. I am determined to dedicate all my experience, knowledge, and efforts to WHO and to serve all countries equally. My goal is to see WHO full of life, energy, and enthusiasm. I would like to see staff at different levels of the organization working together as a strong, productive team to provide the highest level of support to member states. Once again, thank you very much for your understanding and your support. Thank you.
Thank you, Dr. Al-Mandhari. I wish you congratulations and, well, success in your new function.
Thank you, Madam Chairperson, for giving me the floor. And of course, I was not aware about this very kind word of appreciation. I didn't write something, but I would like from my heart to thank the EB board, the EB members for this appreciation. This is the best and the more important appreciation I ever get in my life, and this a remarkable day in my life. Thank you very much. Madam Chairperson, Your Excellency, Dr. Tedros, Honorable Delegate, and ladies and gentlemen, it is a great privilege to join you today during this session of the Executive Board. I stand before you humbled and overwhelmed with your support and with your appreciation. First, please join me on behalf of all staff in the W Eastern Mediterranean region in congratulating Dr. Ahmed Al-Mandhari on his appointment as Regional Director for the Eastern Mediterranean region. I would like also to thank the officers of the Regional Committee for their support and guidance throughout this period to expedite the election process. I would also like to sincerely thank the Director General for his trust and the responsibility he gave me last October to act as Regional Director until the fulfillment of the expedited election process. Over the past 7 months, in collaboration with my colleagues at the regional office and country offices, we have tried to ensure the continuity of work and support our member states. It has not been an easy period, but like Dr. Tedros always says, the staff are WHO's greatest asset. Indeed, despite all the competing challenges, the staff of WHO in the region have defied all adversity to deliver on WHO mission and the needs of the people of the region. I would not have been able to move the agenda forward without their hard work. Please join me in applauding the effort of WHO staff serving at all the three levels, and particularly those in the field and in emergency setting. Their dedication and commitment is an inspiration for all of us of this selflessness they show in serving people of the region. Excellencies, ladies and gentlemen, you are all aware of the challenging situation in our region. With half of its countries experiencing emergencies, either directly or indirectly. Despite the tremendous effort, polio is still endemic in 2 countries in the region. The region continues to host the largest number of displaced population. The NCD's epidemic is sweeping through all countries, while many are still dealing with the burden of infectious disease and climate change effects. However, there is so much potential with the commitment of our member states to the SDGs and to the GPW13. Our countries are on the right tracks to ensure their population are healthier and safer. Building on Dr. Tedros' proposal this morning, I would like to invite the Executive Board members to visit our region, where challenges are very diverse across the different countries, and WHO response range from supporting policy dialogue to filling critical gaps through service delivery. It will be an opportunity for you to witness firsthand the tremendous effort made by our member states with the support of WHO. Finally, I take again this opportunity to welcome you, Dr. Al-Mandhari, and assure you of our commitment to working hand in hand to realize our vision for a region where everyone can enjoy healthy life and well-being, and nobody is left behind. Thank you very much.
Thank you, Dr. Majour. I should now offer the floor to the DG.
What needs to be said has been already said, so mine will be very simple. First of all, I would like to thank my brother, Dr. Jawad Mahjour. He has been an excellent leader during transition, and so proud to have actually the chance to work with you. And you should know that, all the appreciation that you got from the regional committee last week when we were together, and today is because of what you have accomplished during the transition. And thank you for filling the gap, after the untimely days of Dr. Fikri, our brother. So I have seen you firsthand, and you're very remarkable, Jawad. You should know that. Thank you so much indeed. I would also like to congratulate Dr. Ahmed Salim Saif Al-Mandhari. I have witnessed the confidence of the EMRO region. It was actually one round, and they knew who they wanted to vote for. So the first round, it was over. I have witnessed that confidence of the regional committee of EMRO, the member states, and now today, the executive board, the confidence they have in you. So I wish you all the best. I wish you success and look forward to working with you very closely. As what Dr. Mahjour said, it's a difficult region with serious conflicts and geopolitical challenges. We understand that, but we are with you, and we will support you in any way possible. And finally, thanks to the board members here for your confidence in Dr. Ahmed Salim Saif Al-Mandhari. I would like to use this opportunity also, not only the board, but to other member states also have been supporting the whole process. So thank you, Chair. Thank you.